Hi, I'm Dr. Thomas Su of ArtLipo Plastic Surgery, and this is part of our Lipedema series. Today I'd like to talk about the Cankle Liposuction myth. And I call this the Cankle Liposuction myth because what I've been told by patients, probably 80% of the patients I've done on their ankles, calves, and knee areas have had this similar experience. And that is that they've all gone to multiple doctors. It could be 2, 3 different plastic surgeons, and asked about having liposuction to this area of their cankles or ankles and calf areas. And they've been told it can't be done. That's not fat. That is just your muscle. No, it's too dangerous. It could cause injury to your blood vessels. It could cause injury to your lymphatics. We don't do it. Nobody does that. So there are so many different things that my patients have heard, but it's consistent from so many patients that I don't want you, the patient out there, to be discouraged by this. If you've heard these things before, don't give up. Send us your pictures, because I can tell you right now, most likely if you see thicker ankles on your body, thicker calves, that it is fat, that it's not just your muscle. It's very easy to tell. If you grab and you pinch areas on your calf and ankles and you can grab fat, well, it's fat. You can't grab your muscle. So this is a myth, and I've had to think about this for a few years now. Like, why do so many plastic surgeons tell patients that this can't be done or that it's somehow dangerous? Well, if you think about it, doing the ankle and calf areas with liposuction is not something that is taught in a residency program for plastic surgery. We know for a fact that probably only a few percent of all plastic surgeons have ever even touched the area of the ankles with liposuction. So it's not taught. So how do these doctors decide that they're going to start doing this? Well, when you are a plastic surgeon or a cosmetic surgeon and you do liposuction, it's just a matter of time and experience before you decide, okay, I'm going to try doing another area. This is not a trial that someone who is just starting out lipo should do. It's something that you should probably have a fair amount of experience before you ever start exploring into an area that you haven't done before. And this isn't to say that this is all experimentation, because the cankles or the ankle and calf areas have been done for many years. Even though a very small number of plastic surgeons do it, if you take a look at some of the most prominent plastic surgeons out there, and this is in the current day of 2020, I know personally that Dr. Andrew Orden on the Doctor's TV show has done an episode where he did a case of cankle liposuction. I can tell you that if you watch the show Botched with Dr. Terry Dubrow, he has a full page on cankle liposuction. So these are two of the most prominent plastic surgeons in our society right now that talk about doing cankle liposuction. It's by no means something that is dangerous or shouldn't be done. It's just that most plastic surgeons have never done it. And I can't tell you why, but I think it's a matter of ego or pride that keeps them from saying, listen, I don't do it, but you can probably find another doctor that does. That's all they should say, not it can't be done, you don't have fat, that it's dangerous. Those are all fallacies. That is the myth. So I encourage you to check us out, watch my videos, read on my website. I can tell you that we've done, I've personally done about 500 to 600 cases of ankle, calf, and knee liposuction. It's a very, very safe surgery. In fact, whether you're doing this for lipedema or just because you have thicker fat around the ankles itself, it really doesn't matter. It's a very safe surgery. And we do it all awake with micro cannulas, which are very small liposuction cannulas compared to what doctors use when they're doing patients asleep or under general anesthesia. So please contact us. If you're interested in doing this, this is our specialty. So hope to hear from you. Thank you very much for watching.